From the JAMA Network, this is JAMA Clinical Reviews, interviews and ideas about innovations in medicine, science, and clinical practice.
Hello, and welcome to this JAMA podcast. I'm Mary McDermott, Deputy Editor of JAMA, and I'm here today to discuss JAMA's new Insight series on climate change and human health. Joining me today are Drs. Kristie L and Dr. Jeremy Hess. Both are professors of health and global environment, which is based in the schools of medicine and the School of Public Health at University of Washington. Drs. L and Hess have helped to edit JAMA's new Insight series on climate change and human health. Welcome, Drs. L and Hess, and thank you so much for joining me today.
Thank you.
Thank you.
So I wonder if we could start today by having you discuss how climate change can affect human health.
Climate change is altering our weather patterns. Any health outcome that is sensitive to temperature, precipitation, sea level rise could be affected by a changing climate. It's a very long list. There's literally hundreds of climate-sensitive health outcomes. It is going to be impossible to talk about all of them. The big categories are extreme weather and climate events, heat waves, floods, droughts, wildfires, infectious diseases, diarrheal diseases, vector-borne diseases. Quite a few respiratory diseases are affected by changing weather patterns. We also see impacts on food security, particularly undernutrition. The nutritional density of our food is shifting. Crops yields are falling, and so we do see large shifts in undernutrition. There are, of course, a whole range of other issues related to how a changing environment can affect our health by, for example, facilitating the conditions that lead to migration and all the consequences for health of migration. The other side of this is we know that by addressing these issues through reducing our greenhouse gas emissions, will significantly benefit our health and our well-being.
I'm wondering if you can give some specific examples of how climate change has and will affect human health.
So as Chris noted, there's really quite a wide range of impacts to choose from. Some that we've both studied and experienced, unfortunately, include the extreme heat event of 2021 in the Pacific Northwest, which was commonly referred to as the heat dome. We had an unprecedented period of extreme heat with a relatively short lead time in terms of forecasting and early warning, and experienced temperatures that were nearly 40 degrees Fahrenheit above average here in the Puget Sound region, where I practice. And we, while not caught entirely unawares, were certainly underprepared and had substantial health impacts. We had excess deaths. Over 400 people died in Washington alone. We had significant impacts in Oregon and Idaho, in British Columbia. And while epidemiologic studies are ongoing, it's likely, I think, ultimately we'll see that excess deaths from that event probably are over 1,000. And we had also significant morbidity associated with that event and unprecedented emergency department and emergency medical service demand. Several of the hospitals in our healthcare system here were in or were about to be in crisis from that event, and it significantly impacted our operations and patient throughput from EMS through our emergency departments and then into and out of the hospital. And that event has been studied, and an attribution analysis has been done to assess the contribution of climate change. And it was determined that that event would not have occurred without human-caused climate change. So there's a very clear and direct connection between climate change and that morbidity and mortality that we experienced in 2021. We're also, as Chris noted, experiencing shifts in the ecology of many different kinds of diseases, infectious diseases, and as she mentioned, respiratory diseases. So another example is shifts in the pollen season. We've seen a very clear shift in the start of the pollen season for allergenic trees, plants, and weeds in North America. And we can only surmise that similar shifts are happening in other parts of the globe. The pollen season is starting approximately a month earlier than it used to, and it's lasting longer. And we don't have great evidence yet of the direct health impact of that, but it's a very clear linkage between exposure to allergenic pollen and allergic respiratory disease symptoms, which, while merely troublesome for those who have minor allergies, are very impactful for those with more severe allergies and one of the leading causes of absenteeism and presenteeism, a really significant cost burden on the public. And we expect this to continue as the climate warms further. These changes are principally related to warming, not to changes in precipitation or to changes in atmospheric carbon dioxide. The shifts we see, we expect spring to continue to start earlier, the pollen season to start earlier, and we expect to see a shift in the range of many allergenic plants and weeds. And for allergy sufferers in North America, this is perhaps best demonstrated by shifts related to ragweed, which is definitely extending northward and westward. And so we expect to see substantial shifts there. There's also excellent modeling research of shifts in ragweed extent in Europe, and Europe is likely to see a dramatic increase in exposure to ragweed pollen over the course of this century, with a significant increase in associated allergic respiratory disease morbidity and cost. Those are just two of many different examples that we could point to across the wide range of climate change health impacts that Chris alluded to.
And while some of the health events like the heat dome and the temporally associated, increase in presentations to the emergency department with heat-related injuries, clearly one can tie that event to those health outcomes. But can you speak to issues of effects of climate change on health that may not be so easy to draw a causal link, and how science can help us understand effects that climate change may be having on health that aren't so immediately obvious?
One place that is not immediately obvious that Jeremy spoke about are the changes in our ecosystems that mean a range of mosquitoes and ticks are changing their geographic range, changing their seasonality. Spring is coming sooner, fall is coming later, and changing the intensity of transmission. One of the diseases that's been extensively studied is dengue fever, carried by Aedes mosquitoes, Aedes aegypti, Aedes albopictus. Those mosquitoes are changing their geographic range. There's work around the world showing that. Whether or not that shift in the geographic range ends up with seeing additional cases depends, of course, on the robustness of our health systems. So most of the research is showing that the mosquitoes are shifting. But at the same time, we know that there's been a significant increase in the number of cases of dengue fever over the last couple of years. And there's research ongoing trying to determine the extent to which climate change is affecting that shift. There's been extensive research over several decades in Canada looking at Lyme disease, demonstrating that Lyme disease is changing its geographic range. Lyme disease didn't used to exist in Canada and is now well established. That change is because of climate change. And the health systems in Canada, the Public Health Agency of Canada, Health Canada, are tracking the changes in the geographic spread of the tick so that they can set up appropriate surveillance systems to monitor for when disease occurs, to make sure that they set up the programs that are needed to inform the public. People can, for example, in the US, you can send a tick in to see if there's Lyme disease in it to determine whether or not you need to take treatment. So those are just a couple of examples of how shifts are ongoing. Investments in our health system are needed to make sure that we're ahead of those shifts and we're ready so that we don't see increases in the number of cases.
And I'll add to that part of the answer to your question, and Chris alluded to this, but I think a point I'd like to make that's relevant for clinicians is obvious to whom. That if you're not thinking about a particular climate-sensitive disease in your differential when you're evaluating a patient that presents with certain symptoms, you are likely to miss it. And not because you're a limited healthcare provider, but because you haven't been exposed to the idea that climate change is actually changing the range of certain diseases and that you may need to shift your differential and amend your treatment approach. And so one example is we've seen a shift in skin and soft tissue infections associated with Vibrio vulnificus. And this is a bacterium that's associated with shellfish in brackish waters, and the prevalence of the skin and soft tissue infections is directly related to the water temperature. And so people who experience even minor wounds when they're recreating on the beach or working and are exposed to shellfish and get injured are at a much greater risk of getting skin and soft tissue infections from this bacterium. And those skin and soft tissue infections can be really severe. And so if you're, as a treating clinician, not thinking about potential exposure to Vibrio vulnificus, you won't evaluate patients for that. You won't treat it. And it's a rapidly progressive infection that can have really significant morbidity and in some cases mortality. And so it's important for clinicians to be aware of shifting epidemiology of climate-sensitive diseases.
What are some strategies that might be implemented to mitigate the adverse effects of a changing climate on human health?
From the perspective of climate change, we talk about three main strategies. The first is adaptation. In public health, we call this public health prevention, doing the kinds of things that Jeremy just spoke about, making sure that one is aware of the challenges and is prepared, has the kind of health system that is responsive, can be proactive. The second big category is reducing our greenhouse gas emissions or mitigation. And we need to do that urgently and immediately as well to make sure that we don't have even bigger challenges later in the century. And the third category isn't talked about quite as much, but no matter the extent we adapt, no matter the extent we mitigate, we're going to have residual risks. People are still going to suffer and die from climate-sensitive health outcomes. And we do have to have fundamental investments everywhere to make sure our health systems are prepared for more people coming in with heat stress, more cases of asthma in children, more cases of vector-borne diseases. And so thinking about the training that's needed for our health workforce, thinking about the investments we need in integrated surveillance systems, for example.
What are the main obstacles to implementing those strategies?
The first part is investment. The investments in climate change and health and research and implementation are absolutely minuscule. Until December, the total investments in adaptation worldwide under the major adaptation funds for health has been less than half of 1% of all the monies that were spent on adaptation. There's similar challenges with research, just tiny, tiny investments in research. When you look across the research that's been done to date, 2/3 of it's on heat. The rest of it's on dengue, on malaria, a couple of other issues. There's hundreds of climate-sensitive health outcomes. The good news is that it's just starting to shift, but we're way behind the information that decision makers need to take their decisions on adaptation and mitigation, because without that investment, we don't have the evidence that is needed. And that's a topic on which Jeremy is very eloquent.
Well, thank you, Chris. So on top of Chris's point that the investments have been too little and too narrow, up to now, the evidence we've developed has largely been etiologic, meaning focused on harms, which was necessary. We needed to assess the degree to which climate change was, is, and would impact population health in order to clarify how big a priority it should be among the many different priorities we have for improving population health. But the case has been made. It's quite clear that we have a pressing need to address the health impacts of climate change that we're seeing currently and the impacts that we expect. That's not to say we don't need further etiologic research. We do. There are a lot of areas where we don't understand the risks well enough. And of course, we need to invest in research to understand those better. But we very badly need investment in therapeutic research and research into the prognosis associated with climate-sensitive exposures. And when I say prognosis, I mean what happens to a community that is persistently affected by sea level rise. And it's not just prognosis for individual people exposed to a particular climate-sensitive hazard. It's prognosis for an entire community, and coastal cities are a prime example, but not the only one. There are lots of other climate-sensitive impacts, repeated wildfires, for instance, and compound hazards, which we're seeing more commonly with climate change, both related to climate change's environmental impacts, and then increasingly related to our own risk management decisions related to those impacts. So changes in when and how we transmit power, for instance, during periods of heat and drought, because we're trying to mitigate fire risk and liability associated with fire risk. That has implications for people who rely on electricity for cooling and powering durable medical equipment and refrigerating medications like insulin. So it's a complicated landscape, but we need to understand it better. And we also very badly need to invest in evidence related to implementation. We all know that it takes a long time to progress from studies of efficacy, which give us insight into how efficacious an intervention may be in an ideal circumstance, to effectiveness research, where we understand how effective the interventions are in the real world, to widespread implementation. It's roughly a 2-decade process historically. And so if we think about implementation of interventions that we know to have a modest protective effect now, if it's going to take 2 decades for us to implement modestly protective interventions over that time frame, with the rapidity of climate change, we're likely to be far behind and really not protecting people's health in the way that we're charged with.
What can clinicians and healthcare workers do now to help mitigate the adverse effects of climate change on human health?
They can start with educating themselves, making sure that they really understand the risks, how it might play out in their particular community, and what the options are for making a difference in terms of prevention, adaptation, in terms of reducing greenhouse gas emissions. In the US, over 8% of greenhouse gas emissions come from healthcare. It's 5.5% worldwide. And so there's a lot that can be done right now to make a difference.
I agree. And it's a knowledge challenge for the healthcare system. People need to educate themselves, take advantage of increasingly widespread opportunities to learn about climate change and health, which the health impacts are regionally specific in many cases, and they also depend on the population that you're caring for. So you need to really understand those interactions and understand that climate change health impacts are also time dependent, that a lot of these things are unfolding at different rates. And so the health impacts that we'll see, and particularly the indirect health impacts we'll see associated with population movements and other things, will unfold at different rates. And so we need to act on them at different points. But it's not just a knowledge challenge. It's, as I mentioned, very much an implementation challenge, that this is action on these things requires changes in treatment guidelines, requires changes in how health systems acquire energy, changes in what kinds of interactions they have with other parts of the health sector, the public health practitioners in particular. And it's a leadership challenge. This is really important for people in leadership to make room for, to prioritize and highlight, to consider themselves. And I know that healthcare has a wide range of very pressing challenges. I'm very familiar with that. There hasn't been a point in my career in emergency medicine when emergency department capacity in the United States is what it should be. We are always overwhelmed. I understand we have a lot of other pressing needs, but I also understand that climate change is a threat multiplier, and it's going to amplify many of those challenges in ways that really are not part of many of the discussions we're having currently. And those discussions include where we site our healthcare facilities, how we finance our healthcare building, and how we coordinate care under stressful circumstances. We got a crash course on this during the pandemic, and unfortunately, I think climate change is likely to bring challenges similar to COVID-19 on a much more regular basis. And they're going to require nimbleness, creativity, and open-mindedness and strong leadership from people in the healthcare sector.
Are there any other things that you'd like to add?
I would like to add that when thinking about adaptation and mitigation, we're not seeing the changes at scale that we need. We also need to recognize that an enormous amount of change is going on and celebrating the changes that we are seeing. On the technology side, the increase in electric vehicles. We live in the home of Boeing that's testing electric airplanes. There's huge technology change that we need to understand, make sure that there are not adverse health consequences from those technologies, but also celebrate the opportunities it provides us. Just think of the changes in population health research in the last decade with access to remote sensing, to greater use of weather and climate data. There's going to be a period going forward of intense discovery. We're going to discover more health risks of a changing climate. They're going to be more severe in some places than we thought. And we need that information so that we can be more effective and more efficient in moving towards resilience and sustainability. So look for the opportunities to make a difference as a clinician, as a researcher, take advantage of these technologies, and really work to help scale up what needs to be done.
And one other thing that I would like to add is that this is very much a health equity issue. That when you look at greenhouse gas emissions and co-emission of air pollution from fossil fuel combustion, the impacts are not equitably distributed. And this pertains at every scale that you examine the issue at, whether it's really local all the way up to globally. And that has implications for people who are committed to making improvements in health equity. This is a very significant driver of health inequity, both in terms of air pollution and opportunities for improving population health and health equity through climate change mitigation, and also through investing in health protections and adaptation related to climate change. Mitigation investments, reducing greenhouse gas emissions now, will have a really substantial impact, positive impact on population health and a positive impact on health equity. Investing in adaptations will also impact health equity positively in the longer run. We also need to recognize that high-income countries have created this problem. And so it's a global health equity issue as well. And that we have outsourced harms associated with our energy use on the rest of the world. And we have a responsibility to address those harms, to recognize our role in creating that situation and our role in investing and supporting with technology transfer and other partnerships, strategies to reduce those risks in the global south.
I've been speaking today with Drs. Kristie L and Dr. Jeremy Hess, who are professors of health and the global environment at the University of Washington. We've been speaking today about how climate change affects human health, the topic of a new JAMA Insight series. This is Mary McDermott, Deputy Editor of JAMA. For more of our podcasts, please visit us at jamanetworkaudio.com. You can subscribe and listen wherever you get your podcasts. This episode was produced by Daniel Morrow at the JAMA Network. Thanks for listening.